public health system in South Africa's most populous province is in dire straits. In a press release, the Democratic Alliance revealed the outcome of a meeting held last week of the Gauteng Legislature's Finance Committee. Now brace yourself for some shocking numbers. The Gauteng Health Department owes 3.1 billion rand to over 40,000 suppliers. Let's take a look at the hospitals with the biggest arrears. In the top spot is Tembisa Hospital. It owes over 300 million rand to just under 3,000 suppliers, a staggering number. Next is Charlotte Mokgethi Hospital. 2,908 suppliers are owed 234 million rand here. The Far East Rand Hospital owes 230 million to 1,795 suppliers. And then comes the beleaguered Chris Hani Baragwanath Hospital. It's been making headlines recently for an apparent food shortage where hospital staff use their own money to fill the gaps in the feeding scheme. Now, the hospital owes 226 million rand to 2,477 suppliers. Other hospitals, including George Mukari, Steve Biko and Helen Joseph, are also on the list, owing hundreds of millions. The big question is, how has it gotten to this point? And can you blame suppliers for actually pulling out when they haven't been paid? Patients who rely on these public facilities are likely to bear the brunt of the consequences of non-payment. So let's unpack this further. I'm joined by Gauteng Health MEC, Dr. Nomathemba Mokgethi, the DA's Jack Bloom, and Action SA's Lincoln Machaba. Thank you so much for your time. We appreciate it. MEC, I'm going to start with you because the numbers I read are quite concerning. Why has it gotten so bad and why are we at this point?
Thank you very much, Shohen. I think you are correct to say this report was presented at the Finance Portfolio Committee. And in that meeting, we did indicate that this is as a result of budget that was allocated to different facilities, which was insufficient, which resulted in accruals because they could not pay the service providers because of the budget. But we did indicate and we considered that there was some kind of discrepancies or inconsistency in allocation of budget. And we did indicate to the portfolio committee that we are going to put systems in place. We are going to allocate budget according to the pressures of the different hospitals. The other thing that we also need to take care of or to understand, Shehon, is that we have accruals dating back to 2013. And we are trying to make sure that we verify those accruals and we agree with service providers, and then we will be paying them what is due to them. We have been discussing with them and we have agreed that we'll be paying them. The other thing that is also a challenge that we also indicated to the portfolio committee last week was that medical legal claims. We don't budget for medical legal claims. And what happens is that when the attorneys are receiving a court order, they just go straight to our account and then they would then take whatever amount that the court order might have ordered them to take from the department. So those are the challenges that we're facing with accruals and medical legal claims and the discrepancies or inconsistencies in allocation of budget. And the portfolio committee acknowledged that we do have challenges, but they also appreciate that the fact that we are going to be putting systems in place to make sure that that does not okay anymore.
Yeah. Jack Bloom, you raised the alarm on this. You sent the figures out in a statement. Are you buying this explanation from the MEC?
Well, I've been in the legislature a very long time, and I've heard time and again that the Gauteng Health Department is going to be fixed, that they're going to put in the systems, and the MEC is only now saying they're going to be putting in the systems. We hear that there's debt outstanding for 8 years. more than 8 years, and accruals build up, and that's why they run out of money at the end of the financial year. This financial year ends out at the end of March. And I hear the same old story all the time. But meanwhile, if you're a small business and you're not paid on time, you've got your own expenses to pay. You've got to pay your own workers. And I know small businesses struggling. Some of them go out of business. In fact, the ideal is to pay all businesses within 15 days, which is what the Western Cape is doing. So I don't see why Gauteng, as at the figure we had at the end of last year, was that only 22% of suppliers are paid within the legally required 30 days. Only 22%. And in the figures, as we've seen, are 42,000 odd suppliers who owed money beyond this limit, and some of them for years on end. It can't go on like this. I think part of the problem is that there's too many people in acting posts in this department. There's an acting head of department. There's an acting chief financial officer. In fact, there's about 18 senior posts that are acting. Can't we put in decent, competent, honest people and fix up this department once and for all? We've had scandal after scandal in the last few years. It's not getting better, I'm afraid to say.
Yeah, hopefully the MEC can give us some reasoning as to why it's still taking more than 30 days to pay suppliers. And MEC, I'm not even talking about the past and the issues you raised earlier, but why now isn't this being done properly?
I think, Honourable Bloom, you need to appreciate that we did indicate at the Portfolio Committee that when we started in the department, I think in 2021 December, the accruals were sitting at 5.2 billion. And then as we're speaking now, we're sitting at 4.2 billion, simply because we had to do reconciliation. Some of the invoices were duplicated, and we could not just pay. We have to make sure that we are paying people for the services that they have rendered to the department. And it is not true that we have run out of funds, Shohan, because we are projecting to spend 98% of our budget by the end of March. So it really shows that we are not, we have not run out of funds.
Yes, but if you have the money, MEC, why is it taking so long to actually pay suppliers within a month? What's the delay there? What's the main cause?
I've already explained. It's because of the reasons that I've already indicated. And you know how the system it works differently from other provinces, because the facilities will capture the invoice and then submit to the department, and then the department will then capture that into the system, then finance will pay. But what would make things easy for us to pay people on time is when people are submitting invoices with emails or e-invoicing, because we have already worked on that. 72% of our invoices, we are receiving them now with e-invoicing. And then with regard to the positions, the CFO has done everything. It's only we are waiting for the vetting, because we cannot appoint a CFO without a vetting, and everybody knows that that process takes a bit longer. With regard to the filling of vacancies, yes, I agree that there are those vacancies that are still vacant, but we have I think with the CEOs, we have already filled more than 80% of the CEOs of hospitals. And then with other positions as well, in finance, we have made some appointments, and with HR, we have just appointed a DDG Corporate Services. We have appointed a Chief Director, Chief Director Monitoring and Evaluation. And I don't want to take a risk with the CFO to appoint the CFO without a proper vetting certificate.
Okay, let's bring in Action SA. Lincoln, of course, you also issued a statement concerning security guards, but we know that these were not employed by the actual Department of Health in Gauteng, but it was an external process. We've seen them protesting. Outside of the food issues, the late payment of suppliers, we now have this issue. What's your concerns about the state of healthcare facilities in Gauteng?
Thank you so much, Shahan, for the opportunity to be here. Generally, I've just been following the conversation from our colleagues, particularly with interest with what my former colleague, Jack Bloom, has been saying quite closely. And to be honest, I must give him credit that over the years, he's been doing a lot of hard work in terms of going into detail with the issues that we know now about the Gauteng Department of Health. But generally where we come from as Action SA, because we are not yet represented in Gauteng, and we are working hard towards our 2024 project to make sure that when we get there, we don't hear the excuses that, quite frankly, I've been hearing here tonight, but rather that we take action and go into action. If you just ask the general public when they walk in to any hospital in the province, and not only in the province, but even nationally, it just shows that crumbling governments are just the order of the day in this country and in this province. So I think we really, as South Africans, really need to take a positive step in 2024 to make sure that we can really get rid of the deeper crisis that we have, which is in government as a whole. So we need to really change from getting individuals that may not be clear on issues and making excuses over and over, and just really get competent people that are qualified to do the job, that know what they're doing, and that are going to be clear for South Africans.
You reckon the MEC should actually act or get out of her position?
Thinking deeply, I think not only the MEC must maybe just step aside, but I think generally the Gauteng department as a whole needs to step aside.
MEC, what do you say to that? I mean, should you step aside while you try to actually fix things? And also the next question would be, how long until you actually fix things? What's your vision there?
On the issue of step aside, Shohan, I am not going to step aside, because even the portfolio committee acknowledged the progress that the department is making, where Member Randall did mention that, yes, you got into the department that was troubled for years, but we can see some improvement. So we will be giving you an opportunity to make sure that whatever systems that we have committed that we are going to put in place, you put in place. So for me to step aside whilst I'm still fixing things, for me, it does not make sense at all.
All right. Jack, let me bring you in, because you also issued another press release today about very worrying conditions at several hospitals. You're saying that you've established the following hospitals also had bread supply issues, and it's the Far East Rand Hospital, the Pretoria West Hospital, Helen Joseph, among the others. What was worrying for me is that you said that patients at the Charlotte Mokgethi Hospital in Johannesburg have received the following meals this weekend. MEC, and I'd like you to listen to this. Saturday lunch was a roll with a margarine tub, but no plastic knife to actually apply it, and a packet of soup with no hot water. Now, these are patients who are vulnerable, who probably don't even have the energy to try to butter their rolls, and you're giving them soup with no hot water to actually have. So, Jack, I'm going to start with you about what you found, and then we'll go to the MEC for a reaction.
Well, I did a bit of phoning around, and I found out that it's not just Chris Hani Baragwanath Hospital that's run out of bread. Various other hospitals, in fact, Heidelberg Hospital had to go to another hospital to get supplies. I just can't comprehend this. I think it's apparently contracts expired and they didn't renew them or extend them. This is a basic staple. How can we not have bread in our hospitals? And why aren't patients getting proper nutritious meals, meat, fish, chicken, vegetables, fruit, all in short supply. And I was sent pictures by a patient at Charlotte Mokgethi Hospital this weekend. I'm quite horrified. They get a roll and a bit of margarine and, dried dried vegetables. You're sick, you're vulnerable. You need to get your strength back with decent, nutritious food. So I think the rot is very, very deep-seated. I mean, there's problems with management at various hospitals, but let's go back to last year where we had a very competent, honest official called Babita Deokaran who was assassinated. I don't know what other word to use. She was murdered because apparently she was uncovering further corruption. So I think that, very, very strong measures need to be taken in this department. And I think Premier David Makura needs to be held accountable. When he became Premier 8 years ago, he said, quote, he's looking for an urgent turnaround of the Gauteng Health Department. Well, it's just gone from crisis to crisis. It's not life as said in many. It's the PPE scandal. It's the failure to repair MECs Hospital, which I'm afraid is costing patients' lives.
MEC, what do you have to say about what we're hearing? I've been looking at the list of things that people are eating, and there's no way that this is nutritious food for ill people.
Johan, I think what Honorable Bloom is raising here has to be verified. Honorable Bloom, quality assurance and risk management will have to go into these facilities and investigate, because my understanding is that patients are not staffed, and we have enough groceries to can be able to feed all the patients. But now that it is raised in this platform, I think the quality assurance and a risk assessment will have to do a thorough investigation, because it will be my word against honor. So for us to get facts, it needs to be thoroughly investigated so that we can get to the bottom of this.
Would you mind being admitted to one of these hospitals that I've mentioned?
I wouldn't mind.
You would feel absolutely safe that you would be well treated if nobody knew who you was?
Yes.
Okay, great. And do you still think that there's no health crisis in Gauteng?
For me, we do have challenges. We acknowledge that, but it's not a crisis. It is not a crisis. There are challenges. We have acknowledged them and we are working on them, but it is not a crisis.
I hope to talk to you in a month or so, and hopefully there is some improvement in the situation. Appreciate your time. Gauteng Health MEC, Dr. Nomathemba Mokgethi, the DA's Jack Bloom, and Action SA's Lincoln Machaba.